the government's most senior advisor during COVID, says the plan in place before the pandemic was, I quote, woefully deficient.
The inquiry heard evidence from Professor Sir Chris Whitty last night. Let's take a listen.
Was very aware that we essentially had two different things we were trying to balance. The risk of going too early, in which case you get all the damages from this with actually fairly minimal impact on the epidemic, and the risk of going too late, in which case you get all the problems of the pandemic running away. Now, as we will, I'm sure, come on to, my view is, with the benefit of hindsight, we went a bit too late on the first wave.
Were you aware, Stephen Dorrell, former Health Secretary, that you were sitting on a woefully deficient policy? Was it that obvious, or was it just something no one ever considered, no one ever thought would happen?
Well, I don't think anyone knew that the pandemic was going to take the shape that it did. But I think there were 2 points to make in reply to that. The first was that there had been a dry run. I think it was between 2 and 3 years before the pandemic, which had shown that there were inadequate preparations in social care in particular, availability of PPE, several of the things that became clear during the pandemic had actually been anticipated as a result of a dry run from memory 2017, which the government at the time had covered up because it was embarrassing. So that's the first thing that I think we need to remember. The second thing is that what we've heard during the evidence sessions is that the government was slow and chaotic in the way that it responded to the changing picture. Of course, it wasn't easy, but truth is, other governments, including even, for goodness sake, Donald Trump, did it better.
Yeah. Stephen, let me ask you something. You talk about being slow and chaotic. Some people would say, and I'm just interested in just seeing the views from our listeners and viewers today, they are still quite affected by COVID fraud. Right, so they don't like this, and they're putting questions to us today, saying, right, so the Conservatives are putting everything right. Do they intend to recover the 22 billion of COVID fraud? Now, that might be a priority with the electorate. Do you think it's a priority with the government?
Well, I think it's a separate issue, if I may say so. If by COVID fraud you mean people who fraudulently got access to public funds and things moved too quickly. That's, I think, a different question. The question that Chris Whitty was talking about yesterday was, did the government respond quickly enough, and was it sufficiently prepared to take the steps necessary to control a pandemic? Nobody's in favour of handing out public money in a way that leaves the government open to fraud.
What I'm asking you is, as a former health secretary, what priority do you think should be given to that by the current government, or do we just write it off?
No, I don't think you just write it off. I think the current government should be ensuring, first of all, that it's properly prepared for future possible pandemics and that it learns the lessons in terms of the public health response. And of course, it's true that if public money was handed out with inadequate safeguards, first of all, steps should be taken to recover it. And secondly, we should ensure that the lessons in that respect are learnt as well. But they are two completely separate topics.
If you see the inquiry, which obviously is its own intention, as a sort of lesson learning process, what did you make of what we heard yesterday? I felt it was a very different approach to giving evidence to the previous day from the former chief scientific officer. A noticeable difference, I guess, is that Professor Sir Chris Whitty is still in that role, working for the government as our chief medical officer, and he was very careful, wasn't he, not to be drawn into personality comments or political comments. But I do think, obviously I'm interested in what you think of whether we're learning the lessons, but also whether or not you agree with what he said when he said that actually if I'd been at MI5 and come out and said to do something, ministers would have listened, but because I was the CMO, they kind of didn't take it as seriously.
Yes, I'd put it slightly differently. I completely agree with you that Chris Whitty gave evidence in a different way from many of the previous witnesses. And I was delighted by the way that he did, because it does seem to me that once you move beyond the politics to learning the public policy lessons that are available to be learned, Chris Whitty was addressing one of the key ones, which is how you handle scientific evidence when the scientists themselves inevitably are disagreeing, partly because it's a very new area of science. The government ministers, at the beginning of the pandemic, were prone to say we're, quote, following the science, as though science were speaking with one single voice. Of course it's true that when we're addressing something which wasn't previously known and which scientists themselves are learning as they go along, we do need to have a more adult discussion, public discussion, about how we feed scientific evidence into the inevitable responsibility of ministers to make decisions.
Fascinating listening to you. Thank you very much indeed for your interpretation and your analysis. We're out of time, so we've got to say goodbye to you, but appreciate your time this morning. Thank you very much indeed. Thank you.